Welcome to VitSupp. If you are thinking of taking ipill to avoid pregnancy after you had unprotected sex, take out a few minutes to watch this. In today's video, I am going to answer 35 common questions that people have about ipill. Some of them are: how to use ipill? Can ipill fail? Can I take 2 ipill in a week? Can ipill delay periods? Does ipill work after 3 days? To learn the answers to these and 30 more questions, watch this video till the end. Please note that you should always consult your doctor before taking any medications. Number 1. How many times in a month can I take ipill or unwanted 72? Preferably not even once. ipill is for emergencies only. Emergency means sexual assault, torn condoms, etc. To avoid side effects of large dose of hormones, please plan for birth control in advance. Use regular birth control pills or condoms. Doctors do not recommend frequent use of such pills because of the side effects these may cause to your body, like irregular menstrual cycle, heavy bleeding, etc. Number 2. After sex, in how much time should ipill or unwanted 72 be taken? It works best when taken within 24 hours. Taking ipill within 24 hours of unprotected sex can reduce the risk of pregnancy by 95%. Up to 72 hours after unprotected sex, ipill can reduce the risk for pregnancy by 87%. You can take it up to 5 days after intercourse, but it may or may not work. Number 3. Can ipill be taken on an empty stomach? Yes, it is considered safe to take ipill or unwanted 72 on an empty stomach. However, consuming it after eating food can prevent nausea and other side effects. The presence or absence of food in the stomach has no relation with the ipill absorption. Number 4. What is the dose of ipill or unwanted 72? ipill comes packaged as a strip with a single tablet. One ipill tablet constitutes 1.5 milligrams of levonorgestrel hormone, which is used for emergency contraception. Hence, one tablet taken within the stipulated time, preferably within 24 hours and up to 72 hours, is sufficient to stop unwanted pregnancy. Number 5. When should ipill be taken? ipill or unwanted 72 are emergency contraceptive pills and should be taken within 24 hours and up to 72 hours of unprotected sex. Number 6. How can I use ipill? The ipill packet comes as a single oral tablet which you need to swallow with water. You should take ipill as soon as possible and not later than 72 hours. The sooner you take it, the more effective it is. Number 7. Can a girl get pregnant even after taking ipill? There is no contraceptive method that comes with 100% guarantee. All have certain failure rates. That said, oral emergency contraceptive pills have a good success rate at avoiding pregnancy when taken within the stipulated time. If you take ipill just after you had unprotected sex or within 24 hours, the chances of not getting pregnant can increase to 95%. Number 8. Is ipill safe? Yes, ipill is considered safe if you take it as recommended, that is one pill at a time, within 72 hours of unprotected sex. Remember, ipill is for emergencies only. Emergency means forced sex, torn condoms, etc. To avoid side effects of the large dose of hormones it contains, please plan for birth control in advance. Use regular birth control pills or condoms. Number 9. Is one pill enough to stop pregnancy? Yes, one pill is enough to stop pregnancy when taken as directed within the stipulated time, preferably within 24 hours and up to 72 hours. Number 10. How do I know if ipill is working? If you get your periods on time or after a week's delay, it is a good sign that the emergency contraceptive pill has worked. You can also take a pregnancy test in 2 weeks. Number 11. Do you bleed after ipill? Yes, some women may bleed after taking ipill. Vaginal bleeding and spotting are common. It is called withdrawal bleeding and usually occurs within a week of taking the emergency contraceptive pill. It is caused due to changes in the hormones. Number 12. Can ipill fail? No contraceptive method comes with 100% guarantee. However, by taking ipill within 3 days or 72 hours of unprotected sex increases its effectiveness. If you take it within 24 hours, it is 95% effective. If you take it within 72 hours, ipill can reduce the risk of pregnancy up to 87%. Number 13. Can ipill delay periods? The emergency pill can cause your periods to come early or be delayed by a week or 10 days. If you are late by more than a week, consider getting a pregnancy test. The ipill has a 95% success rate when taken within the first 24 hours. Number 14. Why do you bleed after taking ipill? Bleeding or spotting after taking ipill is called withdrawal bleeding. It is quite common in women. It occurs because of the changes in the hormones. Number 15. Can I take 2 ipill in a week? No. Ipill is for emergencies only. Also, ipill is very effective for 3 days after sex and may work for even up to 5 days. Taking an emergency contraceptive pill like Unwanted 72 or ipill too many times will not make it more effective. If you take it within the first 24 hours of having intercourse, it is 95% effective. If you take 1 or even 5 pills after 24 hours, it is only 85% effective. Your safety depends on how quickly you take the pill after intercourse. It is not dependent on pill quantity. If you take more than 1, it does not become more effective, but you can face more side effects due to the massive hormone dosage. Always consult a doctor in these matters to know what is best for your situation. Number 16. Can ipill cause early periods? Yes, in some cases, the emergency pill can cause your periods to come early by a week or 10 days. Number 17. Is one emergency pill enough? Yes, one pill is more than enough. Take it as quickly as possible after intercourse. The earlier you take it, the more safe you are. Safety from pregnancy by using ipill is time dependent. That is, how quickly you take the pill. Taking extra pills 2 days late will not give you extra protection but may give you extra side effects. Please note that ipill can help you avoid conceiving, that is, stop you from getting pregnant. But if you are already pregnant, it cannot abort an existing pregnancy. Number 18. Can I take 2 ipills in 2 days? There is no need to take 2 pills in 2 days because ipill is very effective for 3 days after sex and may work for even up to 5 days. So do not take more than 1 pill. Effectiveness of ipill does not depend on the number of pills, it depends on time. How quickly you take the pill after intercourse will determine its effectiveness. Number 19. Can you get pregnant with condoms? Mostly no. However, no contraceptive method comes with a 100% guarantee. Condoms are 98% effective when used properly. So, your chances of becoming pregnant when using condoms are very low. Number 20. Can ipill be taken after 72 hours? Yes, ipill can be taken after 72 hours up to 120 hours, within 5 days of unprotected sex. But the chances of getting pregnant increase as more time passes. Taking the ipill as early as possible is the key to avoid getting pregnant. Number 21. Does ipill work after 3 days? Yes, ipill works even after 3 days but with reduced effectiveness. If you take ipill within 24 hours, the chances of its effectiveness are 95%. Within 72 hours, it is 87%. Number 22. Does 72-hour pill delay period? Yes, in some cases it may delay your periods. This is because your body undergoes hormonal changes. Delay in periods due to ipill is quite common. If you have taken the pill well on time, that is within 72 hours of unprotected sex, you may get your periods within a week. In case your periods are delayed more than that, consider getting a pregnancy test. Number 23. Can I get pregnant on my period? Yes, although the probabilities are very remote. Number 24. How does ipill or Unwanted 72 work? Emergency contraceptive pills prevent pregnancy through a 3-way process. Depending upon where you are in your cycle, ipill may work in one of these ways. Number 1. If the egg has already been released, the ipill prevents the egg from embedding itself in the womb lining. Number 2. ipill thickens the cervical mucus to prevent the sperm from reaching the uterus. Number 3. It stops ovulation, that is, it prevents the ovary from releasing the egg. If you've taken the pill well on time, that is within 72 hours of unprotected sex, you will get your periods within a week. In case your periods are delayed more than that, consider getting a pregnancy test. Number 25. How to know if ipill is really working? If you get your periods on time or after a week's delay, it is a good sign that the emergency contraceptive pill has worked. You can also take a pregnancy test in 2 weeks. Number 26. If we keep on taking ipills or unwanted 72 hormone tablets, is there any chances of getting fibroids? Ipill is meant to be used for emergencies only. Emergency means sexual assault, torn condoms, etc. There are no studies conducted on the long-term use of emergency contraceptive pills, so we cannot say for sure. However, repeated use can lead to hormonal imbalance and even difficulties in contraception later. Uninhibited repeated use of the ipill or unwanted 72 is misuse of the medication. Number 27. Is ipill or unwanted 72 safe for long-time usage? Ipill is meant to be used for emergencies only. Emergency means sexual assault, torn condoms, etc. To avoid the side effects of large dose of hormones, please plan for birth control in advance. Use regular birth control pills or condoms. Repeated use can lead to hormonal imbalance and even difficulties in contraception later. Uninhibited repeated use of the ipill or unwanted 72 is misuse of the medication. Number 28. Does ipill or unwanted 72 cause fibroids? There are conflicting studies regarding the connection of birth control pills and fibroids. While fibroid growth is not completely understood, research has demonstrated a link between fibroids and hormones. If you already have fibroids, taking birth control pills may lead to additional fibroid growth. It is best to discuss this with your doctor. Number 29. What are the side effects after taking ipill or unwanted 72 hormone tablets? The immediate side effects of ipill or unwanted 72 may include nausea, vomiting, fatigue, diarrhea, headache, breast tenderness, vaginal hemorrhage, abdominal pain, dizziness, flu syndrome. These side effects typically last only for a few days. Number 30. For how many days ipill or unwanted 72 is effective? Emergency contraceptive pills like ipill and unwanted 72 are effective up to 5 days after having unprotected sex. As I've told you, their effectiveness tends to lower as time passes. It's best to take these pills as soon as possible. Number 31. Should I take ipill or unwanted 72 before or after sex? You should take ipill or unwanted 72 only after having unprotected sex. Please remember that they contain high-dose hormones and should not be used in place of regular birth control pills. Number 32. If I take ipill or unwanted 72 before sex, is it good? Since these pills are used to prevent emergency unplanned pregnancies, you should take them only after if you have any unexpected, unprotected sexual intercourse. Number 33. Can I take ipill or unwanted 72 if I have PCOD or PCOS? Yes, you can take ipill or unwanted 72 even if you have PCOD or PCOS. Number 34. Does expired date ipill or unwanted 72 work? Please do not take any expired medication. It may be ineffective or worse, it can even have additional bad side effects. Number 35. Does ipill or unwanted 72 cause delayed periods or irregular period? Yes, emergency contraceptives can cause delayed periods and even disrupt your menstrual cycle or periods in some cases. This is because of the hormonal shock your body experiences. I hope this video will help you keep yourself informed to avoid complications and prevent your health from future risks. If you still have questions about emergency contraceptive pills, you can put them in the comments section of this video. Thanks for watching. Don't forget to like and share our video to spread the information. Do subscribe our channel for more such videos. If you've enjoyed watching this video, do like, comment and subscribe to our channel.